Forbes has come out and declared that these are the best Part D prescription drug plans for 2025. Are they correct? And should you take their advice? I have a number of issues with how they determine that certain Part D plans are the best. So what I'm going to do is go through their list and explain why it matters and why it doesn't. Then I'll tell you how to really tell which Part D drug plan is best for you. And that's what really matters. Hi, I'm Chris Prying, the Medicare analyst. I'm a licensed agent in 16 states. Maximizing your Medicare should be very important to you. My goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. Before I get started, if today is your birthday, George Santayana said, "There is no cure for birth and death, save to enjoy the interval." Before we get into this, you need to know a few things about Part D plans. One, they change every year. That means you should check every year to make sure you are still on a good plan. This is most important if you take more brand name medications. Two, there are an average of 14 Part D plans in each state, but depending on the state, there are only 4 to 6 companies that offer those 14 Part D plans. 3, some companies offer 3 different plans. One is usually geared towards the masses of people. One is geared towards those on Social Security Extra Help or LIS and or Medicaid. And one has a more comprehensive formula that only caters to a few people. But since the changes to Part D, now some companies only offer 2 plans and Aetna only offers 1, which I think is smart on their part. 4, usually the lower premium plans work the best for most Medicare beneficiaries. So please don't think that by paying a higher premium will get you better drug coverage, because it likely won't. 5, Medicare CMS rates Part D plans on a scale of 1 to 5 stars. Most plans fall between 3 and 4. Here's a tip. Just because it's a 4 or 5 star plan doesn't mean it's the best plan or the best plan for you. Just because it's a 2-star plan doesn't mean you shouldn't get it. Okay, let's look at what Forbes said and why. Forbes mentions the following companies: UnitedHealthcare, Cigna, Humana, Aetna, and the Blue Cross Blue Shield companies, which really vary. And except for one company they don't mention, that is about it for the companies that offer Part D. Yes, some states have smaller companies that offer them, but these are the most common ones. Forbes says this was their methodology in how we picked the best Medicare Part D providers of 2025. Quote, to determine the best Medicare Part D providers, the Forbes Advisor editorial team evaluated all insurance companies that offer plans nationwide in terms of how many states in which they provide coverage, the number of prescription drug plans they offer, whether they offer 0 premiums with full income subsidies, the average monthly drug premium across all plans they offer, the average annual deductible across all plans they offer. None of these first things really matter in the end when it comes to picking the right plan for you. They go on whether they offer additional coverage in the coverage gap. You will see that this is bogus. How CMS ranks their drug plans using an average to represent the company as a whole. I'll give my 2 cents on this one. How AM Best rank them in terms of their financial health, which affects how reliable an insurer is when it comes to paying claims. This has some bearing, but as you'll see, they are all about the same. They go on, quote, analysis focused exclusively on providing general summaries of the companies and their reputations in order to provide specific plan recommendations accurately. It is important to consider the zip code and demographic details of the individual seeking insurance coverage. To do so, we recommend that you use the Medicare.gov's Plan Finder tool or seeking the expertise of a licensed, independent, agnostic insurance agent. I wonder who that might be. That would be me. So they start with UnitedHealthcare. Forbes gives UnitedHealthcare 5 stars for their Part D plans. They have an average monthly premium of $59.94, has an average annual deductible of $291.96. Here's why they picked them. UnitedHealthcare is the nation's largest health insurance provider, covering over 43 million people in all 50 states and most U.S. territories. Unquote. I honestly don't see why that matters, and the main reason why they are number 1 is because of their alliance with AARP. Apparently, a lot of AARP members just get UnitedHealthcare because they think that is best for them. Well, in many cases, they are wrong. Forbes goes on, the provider offers 3 Part D plans with specific availability depending on one's geographic location, and its plans earn an average of 3.2 out of 5 stars from CMS. That is pretty much true for all of them. They also state UnitedHealthcare also offers prescription drug coverage with its Medicare Advantage plans. The insurance provider offers zero premiums with full low-income subsidies to eligible beneficiaries, as well as additional drug coverage when a beneficiary reaches the coverage gap. UnitedHealthcare is one of the larger providers to offer insulin copayments of $35 or less, which can be a significant benefit for people managing diabetes, unquote. Again, this is pretty much true for all of the others, so no real advantage for UnitedHealthcare in these last 2 points that Forbes make. They mentioned some pros and cons with UnitedHealthcare. They have an A rating from AM Best. As you will see, they almost all are A rated. They have zero deductibles for some plans, and that's not uncommon. Affordable co-payments for mail order, once again, not uncommon. They don't like that there are few zero copay plans, not a big deal in reality, and the max annual deductible being $505. Again, this is not a big deal as well. Some companies are higher. Cigna is next. Forbes gives Cigna 4.8 stars for their Part D plans. They have an average monthly premium of $36.56, which is lower than UnitedHealthcare. They have an average annual deductible of $370, which is higher than UnitedHealthcare. Here's why they picked it. Cigna has remained a global presence in the world of insurance for over 200 years. It is known for its competitive rates, dependable service, and additional no-cost programs it provides to its customers. Longevity in business is a good thing, but I don't think that's why you should pick a drug plan. Plus, and they should have mentioned this, Cigna sold all its Medicare business to Healthcare Services Corporation. They go on. The company offers 3 Part D plans with specific availability depending on one's geographic location, and its plans earn an average of 3 out of 5 stars from CMS. Ditto, again, for most of them. Cigna also offers prescription drug coverage as part of its Medicare Advantage plans. Ditto for most of them. The provider offers zero premiums with full low-income subsidies to eligible beneficiaries, and it offers additional drug coverage when a beneficiary reaches the coverage gap. That is ditto for most of them. What's more, Cigna typically provides additional discounts for those who apply for coverage online. I doubt that. Everyone pays the same premium regardless of how they apply. This is mandated by CMS. Would only be different if they had Social Security extra help. Forbes says these are the pros and cons of Cigna. They have an A rating from AM Best. Like I said, that's not uncommon. Offers additional savings when beneficiaries shop with Cigna's preferred pharmacies. They almost all, if not all, do the same thing. Their drug formulary covers over 3,000 medications common to Medicare customers according to the company. Not uncommon. Basic plan option doesn't feature a zero monthly premium. As you will learn, it's not about the premium. Not all Cigna plans provide extra savings on insulin for beneficiaries with diabetes. This is not a big deal. And we have Humana. Forbes gives Humana 4.6 stars. They have an average monthly premium of $51.58, have an average annual deductible of $440.13. Here's why they picked Humana. Another large nationwide health insurance provider, Humana covered 17% of all Medicare Part D beneficiaries in 2022, according to the Kaiser Family Foundation. It offers 3 Part D plans with specific availability depending on one's geographic location, and its plans earn an average of 3 out of 5 stars from CMS. Like I said, that's pretty much all of them. Humana also offers prescription drug coverage as part of its Medicare Advantage plans. Once again, they almost all do. The insurance provider offers zero premiums with full low-income subsidies to eligible beneficiaries, and it offers additional drug coverage when a beneficiary reaches the coverage gap. True for most. Humana is one of the larger providers who offer insulin copayments of $25 or less, which can be a significant benefit for people managing diabetes. So maybe slightly better on the insulin than some of the others. Their pros and cons are they have an A- rating from AM Best in 2023, a little less than the others. They have a zero annual deductible available for 2 plans depending on specific drug needs. This is not a big deal. It offers additional coverage when beneficiaries shop with Humana's preferred pharmacies. They almost, again, if not all, do that. They have the highest average annual deductible on our list. Not a big deal because it's not about the deductible in the end. They go on. Customers tend to file more complaints than those of their competitors. That may matter to some. I'm gathering that most of those complaints have to do with their Medicare Advantage plans and not Part D. Next, we have Aetna. Forbes gives Aetna 4.4 stars. They have an average monthly premium of $38.60, an average annual deductible of $336.67. Here's why they picked Aetna. Aetna, a CVS health company, is one of the largest providers of Part D plans, which it sells under the brand name SilverScript. As you are seeing, they are all large nationwide companies. It offers 3 Part D plans with specific availability dependent on one's geographic location. This, folks, is false. They only offer one plan now in 2025, and its plans earn an average rating of 3.5 out of 5 stars from CMS. Gee, what do you know? Right between 3 to 4 stars, like I said. Aetna also offers prescription drug coverage as part of its Medicare Advantage plans. This is getting really old, isn't it? While Aetna doesn't offer zero premiums with full low-income subsidies to eligible beneficiaries, it does offer additional drug coverage when a beneficiary reaches the coverage gap. What? There is no coverage gap donut hold anymore. Come on, Forbes, get a clue. Aetna is also one of the larger providers to offer insulin copayments of $35 or less, which can be a significant benefit for people managing diabetes. Whatever, same old, same old. Their pros and cons are they have an A rating from AM Best. Getting to sound familiar? Copays for Tier 1 medications are $2 or less for every plan. There's only one plan, remember? That's good, but pretty common. Offers additional savings when beneficiaries shop with Aetna's preferred pharmacies, like most, if not all, do. Customers tend to file more complaints than those of their competitors. Wait a minute, I thought that was Humana. And like Humana, I gather that's due to their Medicare Advantage plans. They have a maximum annual deductible of $505 for the Silver Script Choice plan. Once again, the deductible is not what matters in the end. And last, according to Forbes, the least is Blue Cross Blue Shield. There are many Blue Cross Blue Shield companies, so take this with a real grain of salt. Forbes gives them 4.1 stars. They have an average monthly premium of $86.24, an average annual deductible of $311.14. Here's why they picked it. Blue Cross Blue Shield is a collection of 34 independent and locally operated health insurance companies, so its coverage options tend to vary by state more than others on our list. So is that a good thing or a bad thing? However, it offers 3 Part D plans with specific availability depending on one's geographic location, and its plans earn an average rating of 3.3 out of 5 stars from CMS. You get the picture by now on the star ratings, I hope. Blue Cross Blue Shield also offers prescription drug coverage as part of some of their Medicare Advantage plans. Really? The insurance provider only offers zero premiums with full low-income subsidies to eligible beneficiaries to customers of its Oklahoma company, though it does offer additional drug coverage when a beneficiary reaches the coverage gap. Folks, the coverage gap is gone. There are only 3 stages now: the deductible, the initial coverage limit, and catastrophic coverage. The donut hole is gone. They go on. What's more, depending on the particular Blue Cross Blue Shield company, beneficiaries with diabetes can access generous insulin coverage. For instance, CareFirst Blue Cross Blue Shield began offering insulin to its beneficiaries for $0 out of pocket prior to meeting their deductible in 2021. Okay, finally something they mentioned that might be an advantage over some others. Their pros and cons are they have an A rating from AM Best. Were you expecting something else? Many plans offer extra discounts through preferred pharmacies and mail order pharmacy services. Yep, many plans feature a comprehensive drug formulary according to the company. Yep, as I mentioned, they almost all do that. Aetna obviously doesn't, since they only have one plan. Limited geographical coverage compared to other providers. True, but all plans are based upon the state you live in, but can be used nationwide with the plan's pharmacy network. They go on, their plan portfolio can be confusing to navigate since it varies across many companies. That is a ridiculous statement. You don't navigate multiple Blue Cross Blue Shield plans that are in different states. You only compare plans that are available in your own state. Okay, before I rail on Forbes' outcome and advice, they do conclude with this, quote, while all Medicare Part D plans are provided by private insurance companies, the plans themselves vary significantly in terms of their costs and the drugs they cover. Each Part D plan features its own drug formulary, cost of drugs for which the beneficiary is ultimately responsible, monthly premium, and annual deductible. For this reason, it is important for anyone interested in Medicare Part D coverage to review each of their plan options very carefully to make sure they pick one that offers the drugs they need or are likely to need in the future at rates that work best for their budget, unquote. In case you want to know or care, here's what I think about their outcome. 1. As you have seen, there's lots of parity with these Part D plans, and that's because they all have the same CMS requirements that they have to meet. 2, how do you really say one plan or company is 5 stars and another is 4.1 when you really don't mention any significant difference between them? 3, I don't think they did Medicare beneficiaries a good service, other than tell you, quote, we recommend using Medicare.gov's Plan Finder tool or seeking the experience of a licensed independent agnostic agent, unquote. And they said it's important for anyone interested in Medicare Part D coverage to review each of their plan options very carefully to make sure they pick the one that offers the drugs that they need or are likely to need in the future at rates that work for their budget, unquote. Those are about the only two good things they really said. Now, how many noticed that one company was missing? And I'm guessing it's missing because this one company has a B minus rating from AM Best. But this one company also has the only zero premium plan that I know of, and it's the lowest premium plan in most states, if not all states. 2, it offers the lowest overall cost for a Part D plan in the majority of cases. By lowest overall, I mean, and Medicare means the total you pay in premium, deductible, and copays or coinsurance. So when one takes their medications and puts them into the Medicare prescription calculator, chooses their pharmacies of choice, this plan is typically the lowest overall, regardless of the medications you take. Like I said, a more expensive premium doesn't usually mean you get better drug coverage. It's not always the lowest, of course, and sometimes it could be very expensive if you have to be on certain drugs. 3, it is the most popular Part D plan for probably the past 5 years. Now that doesn't mean you should get it, but that should tell you something. 4, and guess what? It's a 3.5-star plan too. And that company or plan is WellCare, whose parent company is Centene. Here's what's kind of funny. Value Penguin says WellCare is the best and cheapest overall. Kudos to Value Penguin. Personally, I've enrolled a lot of my clients into the WellCare plan. Unfortunately, due to the nature of Part D and CMS right now, WellCare no longer compensates agents for selling their plans. And I'm quite confident this will cause a number of agents to steer Medicare beneficiaries to a plan that does compensate them. For the most part, my clients are happy with WellCare, but they are the only Part D company I've had clients complain about their customer service. The good news is you shouldn't need to deal with customer service much, if at all, with a Part D plan. So how do you pick the right plan as in the lowest overall cost plan for you? Or maybe I should say, here's how I pick the right as in lowest overall cost plan for you. Instead of telling you, I'm actually going to show you. Okay, to find the lowest overall cost drug plan, we are going to go to Medicare.gov, an official website of the United States government. We're going to scroll down and we're going to click on Find Plans Now, and then we're going to enter our zip code. If your zip code is shared between different localities, different counties, cities, make sure you check that off. It can matter, but usually not for the drug plans. And we're looking for a drug plan, so we're going to select Medicare Drug Plan Part D and Find Plans. Over here, Medicare is asking you if you get any help for your drug costs, whether it's Medicaid, Supplemental Security Income, the Medicaid Savings Program, or extra help. Now, a lot of people do get extra help. If you know for sure that you get it, that's a benefit from Social Security, also known as low-income subsidies. Then you would check those boxes. But for most people, we're just going to go, I don't get help from any of these programs. Do you want to see your drugs costs when you compare the plans? Of course, that's why we are doing it. And then we click next and we start entering some medications. So I will do that for you. So we got maybe some atorvastatin, and then you want to make sure that you select the dosage of whatever it is and then the quantity. And let's add another one, and then maybe we'll add metoprolol. And then you scroll down. Now there's metoprolol tartrate and succinate. Make sure you pick the right one. And then we're going to select whatever tablet that is, and we're going to add that to our drug list. Now, sometimes you will see for some medications that they are both tablet or capsule form. So you make sure you pick the correct one because it can make a big difference in the cost. A lot of times the capsules are more money than the tablets. So that's good enough for now. We're going to go done adding drugs. And then we're going to look for pharmacy. So it defaults to 5 miles out. For me, I'm going to select always mail order. Maybe you have a Costco nearby. Let's go with CVS because almost everywhere there is a CVS. And then I want to see Walmart, which I don't see. So if I expand this out to 10 miles and apply, and then I can type in the pharmacy name, Walmart, find pharmacies, and boom, there it is. And then I'm going to add those in. And so what it's doing automatically now brings you to the results page. And you will see right here, sort plans by defaulted, lowest drug cost plus premium cost. So the lowest overall cost, what you pay in premium, any deductible that would be applicable, and the co-payments or co-insurance that you would have. So in this case, of course, the WellCare Value Script came out to be the lowest. And then what you could do is you could compare plans here. So if you want to compare the two least expensive ones, you would do that. And you would hit compare, and then you can kind of see them side by side and what the different costs are on there. So you can clearly see for the most part, WellCare is cheaper. Unless you want to go to Walmart, then the Humana is cheaper. So we'll go back. And then what you can do is you can get specific plan details on the plan, and it tells you the premium that's on there. And as you scroll down, it will tell you the pharmacies, if they're preferred or not. And if you go to preferred, usually it's cheaper. And then it will actually break down the cost that you will pay for the medications at these different pharmacies. And this is the total yearly cost of what you will pay for these medications based upon the rest of the year, not the entire year, because I'm doing this in May of 2025. So it's calculating maybe 7-8 months worth of payments on there. And you scroll down, it gives you a monthly breakdown as well. And then you can get more detail about each one of those. So that is how you check. Now, suppose you like that particular plan. Then what you can do is go, oh, I'll take it. That makes sense. And I go enroll, and I can join a plan, and I can go right through here. If you're new to Medicare or you've already had it, whatever the case may be, you can do that. Now, of course, you need my help with that. More than happy to help you with that. Again, WellCare is one of the companies that does not pay me a commission. I only do it for existing clients and clients that are getting a Medicare supplement policy. Otherwise, you're going to be on your own, but hopefully this is enough to help you out. Thanks. And that is how you find the lowest overall cost, or as Forbes would say, the best plan. Then remember to check the plan each year during the annual election period. All right, that's it for today. I'm not too happy with Forbes on this one. I do hope that you found it helpful, however. If you have any questions about what I've just gone over, and when you are ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about all your healthcare needs and philosophies and budget. I'll do my best to answer all of your questions and concerns that you may have, and once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance and perhaps your health, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prying, the Medicare analyst. Make it a great day.